Have you ever felt stress or pain, and you are not quite sure how to deal with it? Have you felt tempted to try drugs or alcohol as a way of coping with stress and pain? Just like any other feeling, stress and pain are a part of life. But many find themselves incompetent of facing the harsh realities of life, making them pursue something that frees them from all worries. Hello, viewers. Welcome back to Social Tomatoes. Today, experts are discussing about a sensitive topic which can harm our younger generation in many ways. That is, the matter of alcohol and drug intake in youth. National Institute of Drug Abuse has reported that from 2017 to 2019, the percentage of teenagers who said they vaped nicotine in the past 12 months roughly doubled. Subsequently, drugs intake, especially among youth, has risen over time, and the statistics say that, for 8th graders, it has increased from 7.5% to 16.5%. For 10th graders, from 15.8% to 30.7%. And for 12th graders, from 18.8% to 35.3%. However, in 2020, the rates almost stayed steady, mainly due to lack of access and adult supervision during coronavirus lockdown worldwide. What makes drugs or alcohol tick? We all know that drugs and alcohol are bad for your health. Then what good do people get by taking them? Consider it ironic, but we all have crossed the path of drugs or alcohol one way or the other, either by its direct consumption or sometimes even medically, being prescribed in the form of syrups or tablets by your healthcare provider in order to relieve your pain and agony. That is, not to make you feel high. In medicinal terms, drugs are pharmacologically active substances that change your mental perceptions. When your brain is exposed to one of these substances, they trigger areas of your brain that give the feeling of pleasure. Some people want to feel that pleasure over and over again, so they continue to take that substance, and sometimes start taking it in larger amounts. Thus, there comes a time where the body and brain get so much used to it that it needs the substance to feel normal again. That is called addiction. There is a wide variety of drugs that are used to feel good or high. These include legal substances like prescribed medication and caffeine, substances legal for adults but illegal for teens, such as alcohol and nicotine products. Also, marijuana is prescribed by some doctors for providing relief to diseases like Parkinson's, stress, etc. However, the same marijuana once carried in more than limited quantity becomes a crime. Similarly, many other drugs are straight away illegal, like cocaine, heroin, and methamphetamines, etc. Alcohol versus soft beverages. We all know that there are many soft beverages and drug substitutes available in the market which can replace alcohol or drugs any day. Then why do teenagers consume alcohol when they have all kinds of beverages available to drink? What tempts them to take alcohol or drugs? A study has shown that it is not always the feel-good factor for teenagers' addiction to alcohol and drugs. There are many supporting reasons for the abuse of addictive substances in teens, which are poor family relationships and bad parenting. Bad parenting plays a major role in teens getting addicted, especially in cases where parental drug abuse was found to be directly associated with child maltreatment. Children are found to have adopted drugs and alcohol use. Adolescence. One of the major causes is age itself. Adolescence is a high-risk period for drug abuse for numerous reasons. For example, growing up is stressful. There is stress associated with puberty, the development of a new identity, and separation from parents. It is not surprising then that 1 in 4 adolescents undergo serious psychological jeopardy in that area of life. Lack of social bonding. History of low quality and consistency of family management. Lack of family communication. History of being abused or neglected. Emotional or psychiatric problems. There is a tendency for adolescents who have problems relating to drug abuse or drug dependence to have higher rates of emotional or psychiatric problems than other adolescents. Inadequate social skills, rejection by pro-social peers. Association with peers who use drugs is one of the strongest predictors of adolescent drug use. Peers have a substantial impact on drug use behaviors, and this impact is influenced by other factors, such as family influences and social skills. History of low commitment to education. Being a failure at school. Traumatic life events. Children who have experienced traumatic life events, like sexual, emotional, or physical abuse, neglect, or stay at refugee camps, are at a high risk of detrimental outcomes, such as illicit drug use, self-destructive, and suicidal behavior. Lack of knowledge. Drug use and misuse have been attributed to a lack of knowledge of the risk associated with the use. Effects of addiction. It's not shocking that males tend to start drinking alcohol at an earlier age than females and be more likely to drink heavily and to experience alcohol-related problems. Nevertheless, whether it is a boy or girl, drug or alcohol addiction among teenagers results in missing school, work, or social events to use a substance, leading to being an early school dropout, poor social development, while affecting sports performance, work, or relationships with family and friends. Hence, addiction can be very harmful to teens and all those around them. How to get over drugs and alcohol. Rehabilitation centers are built in particular to bring these addicted individuals back to the path of life they once lost. Quitting can be very difficult and uncomfortable, but drug addiction is not a condition that is not preventable or treatable. Treatment options may include a detox program. This program will include care from trained staff who watch the heart and blood pressure of the patient closely. Medications can also help remove the remnants of chemicals in the body left over from substance abuse. Other ways to quit addiction. Participating in new activities to replace old habits in order to find other ways to manage stress and emotions, such as meditation or deep breathing, exercise, spending time in nature, listening to music, talking to a trusted friend or family member. The best way to avoid the consequences of drug use and addiction is to avoid starting in the first place. Also, if you have any interesting or good story which can motivate the listeners, do share it in the comment section below. Your one story will motivate people to stop over-drinking or drugs and start caring about their health. So, be a role model and put value in someone's life. We will also distribute some surprises between the best storytellers, so give your best to win the surprises.